If you strictly go into the DSM, there are some pretty hard and fast rules right now. What's interesting is the hard and fast rules that are in the DSM aren't really as much help in clinical practice as I think we need sometimes, but more importantly, I'm seeing kids in my practice who carry all sorts of diagnoses who don't fit these labels that are in the DSM. And we're going to talk about the DSM-5 that's going to come out within the next 2 years and how they're proposing right now to change the definition because it's a pretty dramatic change. And I don't know from the clinical standpoint whether you guys, I feel it's going to make my job even harder. And so we're going to talk about some of the changes that are proposed. But basically, right now, autism is defined as impairments in social interaction and communication, restricted and repetitive and stereotyped patterns of behavior, interests and activities, and delays before the age of 3 in social language or symbolic play. Okay, now, right away, one of the big issues that I've found in my practice over the last couple of years is I find kids 15 or 16 who weren't picked up on the spectrum before because it wasn't even in the ballpark. Then what do? Because you don't know what happened before age 3, parents have a really hard time remembering. One of the things that's kind of great about the autism diagnostic interview, as long as it is, I really dislike it in some ways because it's just so long, but you get such great information. And one of the things they do is they anchor parents in a way with memory, given how memory works, with what else is happening in their lives to try to take them back to that period in their life to be able to try to remember what was going on with the child. You can do that in a clinical interview, and I frequently use that from a clinical interview standpoint without using the whole autism diagnostic interview, but it's one of the things I love about it. You've got high functioning autism, and I put that here not because it's in the DSM, but what the research is fairly clearly starting to show is that autism is bifurcated. The kids who are lower functioning, very few social skills, no language early on, there are some kids, and a lot of those kids are the kids that any amount of intervention doesn't seem to do much good. And that's pretty sad. Bless you. And I think we're going to talk about some of the economics about autism later in the day. But when you're talking about, bless you, $3.1 million over the course of a lifetime for one child with autism, and we're in a point where schools have very limited resources, how do we spend those resources with kids on the spectrum has become, as I'm sure you all are faced. I have parents who come in and ask for this diagnosis because right now it's one of the few diagnoses in the school that's actually getting money and help and support thrown at it. And we're going to talk about ways to initiate the due process hearing and IEEs and all of that later on. But the politics and the financial aspects of this, I don't know that it was signed this week, but there's a bill on the governor's desk right now which will up autism treatment and provide that ABA in California has to be covered by insurance policies. So that's a huge change in California because a lot of insurance companies still were seeing applied behavior analysis as a fringe treatment that shouldn't be covered. So high functioning autism, those kids with a higher IQ tend to do better. And the earlier we can find those kids and intervene, the more they're going to even do better. Okay, so those are the kids you really want to try to pick up early. You want to try to pick up all of it, but these kids in particular, when you intervene, they do much better. Asperger syndrome. So this one is impairments in social interaction, just the same, restricted and repetitive interests and activities. Here's the biggie, and this one I find is the one in the DSM that gets dropped the most. There can't be any general delay in language, okay? So if you have a child who comes in and by history parents say, yeah, they were delayed, by definition, Asperger syndrome cannot be given as a diagnosis. And it's done all the time. I see it absolutely all the time, yeah. Absolutely. So if they had a general delay, you should not be giving that diagnosis, but I see it all the time. It's one of the first questions I ask. No delay in cognitive development or self-help skills, adaptive behavior, and curiosity about the environment in childhood. These are mostly kids I find, and again, just full disclosure, I am very conservative in my diagnosis. I have given this diagnosis to maybe 5 kids in my practice over the last 10, 15 years. I find more and more kids with this diagnosis who I wouldn't diagnose. It's all an individual preference. Part of the problem with the autism diagnosis is exactly that, because it's very dependent on the provider that you see. A lot of times their training, how many kids they've seen with autism, and I think that's when you get to a place where that's focusing your diagnostic process, I think that's very hard, and it's hard for families because they can go see me or they can go see somebody else where, you know, we could come out with 2 very different things. Now, they're not going to be so different, but if somebody will give them a diagnosis, and what I'll tell parents when I'm saying, look, your child is way more related than most kids on the spectrum. That's a lot of the conversation that I'll have with folks. And they are much more social than most kids on the spectrum. And I'm going to do a rule out. And we're going to give you a provisional diagnosis, and I'll put rule out on my diagnostic section of my report. And we're going to intervene like it is autism, but I actually think if we do this within 5 years, we're going to see some of these symptoms reduced. I've had enough kids in my practice now through 10 years. With the exception of 1, I've usually been pretty correct about that. The issue is that other than Asperger syndrome or autism, what diagnoses do we have for kids who have social issues? And what's the most important skill that kids have in school and in life? Social skills, yeah. Right? But we've only got 1 category. So anytime a child has a social impairment, you tend to see them in this category. Does that sound right to you? Yeah? Is that what you're seeing? Other people? Anybody seeing anything differently? Okay. DSM-5. Now, DSM-5 is actually doing away with Asperger syndrome and pervasive development disorder and CDD. Okay? It's actually going to be autism spectrum disorder. Autism spectrum disorder, in some ways it helps us because I don't have to decide and I don't have to say, did they have general language delay, did they not? I don't have to get into the semantics. The hard part, and they're in field trials on this right now, is for those of us who do kids work, the biggest thing that we do for kids is provide recommendations for interventions. The rest of the report is almost useless. I'm going to shorter and shorter reports these days because I think nobody reads the rest, and that's okay. 1-page summary, and then the interventions and recommendations are the most helpful, I think, these days, because that's really what people are going to use. And if you don't have that from a quote-unquote label, which I think is the benefit of having a diagnosis, right? A diagnosis for the sake of diagnosis is useless. The alphabet soup really doesn't impress me. But the point of a diagnosis is to be able to identify strengths and weaknesses so that then you can work with educators to be able to say, how is this child going to be able to access the curriculum? And I think this makes that very hard for us. There are a lot of wise people on this committee, some of whom I trained with. So I'll wait to see how it shakes out. Really good people who are clinicians and academics, not just academics. So I'm hopeful that they'll understand this a little more when they start to see that it's really hard to implement. Stay tuned, and we can talk about that more and go on the website and look at the DSM, sort of their rationale if you'd like. But the language delay goes away, so then I don't know the difference between Asperger syndrome and autism. I don't know sort of how those skill sets, maybe that doesn't make a difference for clinical intervention, but I think it's going to be pretty difficult to understand. Questions about that? Okay. Talk a little bit about this. How many of you have heard of nonverbal learning disability? 2, 3, 4, 5, about half of you. Okay. Has anybody ever used it as a diagnosis? No. Have people come into it with as a diagnosis and have read about it? Okay. So this first appeared in the literature in 1967. There's a great book, and I found it on Amazon a number of years ago. Johnson and Michaelbust, 1967. They had a term called nonverbal disorders in learning. I love the term, and I wish it would come back. It's one subtype had deficits in social perception. Some of these kids had visual spatial issues, and I'm sure everybody here has seen those kids in practice, and there's really, you have to give them a diagnosis of a learning disorder not otherwise specified. Some of those kids can't tell time. Some of those kids who have difficulty telling time have executive function deficits, and so you can go to the executive function diagnosis, but it's really a broader term as they used it in 1967. Byron Roark, who just passed away a few weeks ago, in 1987, first coined the term nonverbal learning disabilities. It never made it into the DSM, and I would suspect it will not at this point. As it's defined currently, it's primarily a diagnosis made with test scores. So the deficits in tactile perception, nonverbal problem solving, mechanical arithmetic, social perception, a sense of time, visual spatial skills, psychomotor coordination, strengths, and verbal. So these are the kids who alienate other kids because they talk like little professors. Okay? They say things that are inappropriate. They apply to children with neurological injury and from birth. So these are kids with spina bifida have been found to have nonverbal learning disability, a variety of other neurological disorders. And as of today, I've only seen studies with Caucasian children, and I think that's really relevant because of the differences between, it's hypothesized to be a right hemisphere, bless you, a right hemisphere disorder, so you've got right hemisphere versus left hemisphere issues. So in a less language-based society, you wonder how that translates because language is left hemisphere. So I just ran through a lot. Everybody with me on how I was running through that? Okay, language, left hemisphere. As a neuropsychologist by background, I sort of use these terms quite frequently and happy to go through them a little bit more if folks want me to. But right hemisphere tends to be more visual spatial, emotional based. And so when we think of nonverbal learning disability, it's been hypothesized to be a disorder of the right hemisphere. You don't see that many kids with it. Other than some research I've done. There's a researcher at Michigan who's doing a Peg Semmered-Kleichman. Hind is doing a little bit of it, or sorry, Semmered-Kleichman, not Hind. She wrote an initial paper back in about the same time as this with George Hind about nonverbal learning disabilities. Now these are the kids that are really the kids who I call the squishy kids. The squishy kids. Okay, there's clearly something going on neurologically. Okay, there's just, they're very high functioning most of the time, very high IQ. There's some soft neurological signs. What do I mean by that? Meaning low muscle tone a little bit. They have trouble tying their shoes, trouble riding a bike. These were the kids who I think were picked up in the early 60s and 70s as minimal brain dysfunction. And again, I don't like any of these terms. The part of the issue is the literature has developed these. These are some of the kids who, if you go into the speech and language disorder literature, have the semantic pragmatic disorder, language disorder. I wrote a chapter on a pediatric neuropsychology intervention book that talks about all the different labels that have been applied to what I think is the same group. Social relationships are so hard. When you think about, my favorite example, I have two wonderful examples, one from the little boy's test protocol that we'll talk about later. Let me make 3 points. Let me go back a second. When I went back to school and wanted to do my dissertation on I wanted to understand the relationship between cognitive abilities and social perception, okay? Because I was seeing kids with a discrepancy in IQ, and I wanted to understand how visual spatial deficits or math deficits contributed to a social problem. I couldn't find a test for my dissertation. Yeah. had to go to Canada, and this was 94 and 95. We're not talking about dark ages. Yes, it was a while ago, but we're not talking about the dark ages, folks. We had social abilities back in 94 and 95. There was no test. I had to go to Canada and get something called the Child and Adolescent Social Perception Measure. The reason I love that test, it was environmentally relevant. It showed 5 kids around a drinking fountain, everybody talking at the same time, everybody moving quickly, having to read. You know, if you think of all the components of social interactions, you have to read the facial action, you have to be able to pay attention to it, so your attention has to be good, you have to bring it in, you have to perceive it on the back of your brain, on your occipital lobe, has to go through the thalamus, lateral genetic nucleus, sorry I didn't pronounce that right, LGN, can't talk this morning yet, more coffee needed, and be able to process and interpret and put the right interpretation on that and then act on that interpretation. It's a very complex skill. The NEPSI looking at a social situation or a picture doesn't quite capture that. And I think therein lies the difference. That's why we're going to talk about things like the social responsiveness scale, which I use a lot in practice now, which helps me quantify those sorts of things in a different way. Yes. And so we're going to talk a little bit more about that. But the CASP would take the verbal out of the situation, have the kids listen to tone and prosody, and look at the situation with 4 or 5 kids. It never got distributed commercially, so I was really bummed. But there really aren't good, there are very few social instruments out there that really capture what kids have to go through, especially when you get into, I think a couple of you said you were seeing adolescents. It gets really hard to read. And so I think that you can have a child with good test scores on some of the tests that are out there and still not do it well. Observation is the best way to do that, if you can do that discreetly. With adolescents, trying to go to do an observation, I find incredibly hard.